This is something that we had prepared for some time, a rising spike in the number of COVID patients that really threatens our ability to provide capacity to care for them in conventional space. And so it's something we anticipated, but really, hope never would come to pass.
While it's a facility Dr. Ian Pereira hoped wouldn't have been needed, at this time, he says it's the only option to fight rising COVID-19 numbers and overflowing hospitals. This is the first of its kind built in Ontario, Joseph Brant Hospital's new pandemic response unit.
We have been prepared to open for a long time, but we actually put our first two patients in the PRU today. And they were patients transferred from the acute care area of Joseph Brant Hospital into the PRU. And so far, so good, fingers crossed, but certainly we are ready to ramp up very, very quickly should the need arise.
Early in the pandemic, the Ontario government asked hospitals to come up with plans to increase their capacities. Joseph Brant Hospital teamed up with other facilities in Hamilton and Niagara. The resulting pandemic response unit, a 16,000 square foot structure, was constructed in April 2020. Inside are 73 beds for COVID-19 patients who are medically stable with mild to moderate symptoms.
What we are trying to do is learn from the lessons of the first phase of the pandemic. And you'll recall that we shut down scheduled surgeries and clinic visits, and the healthcare system kind of ground to a halt because we wanted to create capacity. And what we are doing now is we're trying to create capacity in the pandemic response unit so that we can free up conventional capacity.
Administrators say the hospital will be fully staffed just like any other ward, with doctors, nurses, respiratory therapists, and other support workers.
We built the pandemic response unit in the spring, and we've had plans for how we would open it for a really long time. And what we have been able to do is recruit dedicated staff for the unit without cannibalizing from the hospital itself or from our regional partners.
The building is meant to be occupied no matter the weather, and its air is also specially pressurized and filtered to reduce the danger of virus transmission. Patients will be allowed visitors to the facility. Brandon Rowe, City News.